Hello guys, I welcome all of you to today's PHARMCAST. Today also we'll discuss 5 drugs of choice, 1 monoclonal antibody, and a few questions that students have asked in the last or the doubt section, right? So let us straight away begin with our drugs of choice, guys. The first one for today is organophosphate poisoning. And organophosphate poisoning, guys, is a pet topic, right? For every exam in our country, they love to ask about organophosphate poisoning, and there is a simple reason, because you will encounter a lot of cases when you actually go to practice. And organophosphate poisoning, guys, drug of choice is atropine, right? Remember what I'm saying. Drug of choice, they ask you, your answer is atropine. But if they ask you most specific drug, mind the words, not drug of choice, most specific drug, then your answer would be, what do you think your answer would be? Your answer will not be atropine, guys, then. Your answer would be oximes like pralidoxin, right? So they do ask you which is the most common oxime used in India, and your answer would be pralidoxin is most commonly used. Now remember one thing I would like to clear, that atropine is an anti-muscarinic drug. It is not an anti-nicotinic drug, which means what? When I give organophosphate in organophosphate poisoning, when I use atropine, I would get the patient rid of only muscarinic symptoms but not nicotinic. So what removes those nicotinic symptoms? These are the oximes. So if they ask you which of the following drug would be used for the nicotinic symptoms in organophosphate poisoning, your answer will not be atropine again. So you need to understand the concept here, right? Right, let's move on to our next disorder for today, osteoporosis. Guys, osteoporosis, all of you know that the drug of choice are bisphosphonates, right? And which one should we prefer? To begin with, see, it's always easier to use an oral drug for long-term management. So we prefer oral bisphosphonates, and the preferred oral bisphosphonate, it is alendronate. So alendronate is more preferred than risedronate. These are the two oral preferred bisphosphonates. And we use the parenteral or intravenous bisphosphonates like zoledronate or pamidronate in case the patient is not adequately responding to the oral bisphosphonate. So osteoporosis, single best answer, drug of choice, alendronate. It's an oral tablet, but remember these drugs, they cause esophagitis, right? So what do you ask the patient here? To take the drug with a full glass of water and then not to lie down for at least 30 minutes. So he should sit or stand for at least 30 minutes because we want the drug to pass down to the stomach as soon as possible. That is one aspect. Second, food interferes with absorption of bisphosphonates, which means what? You should take bisphosphonate on empty stomach, right? Alright guys, moving on to the next disorder for today, osteosarcoma. See guys, osteosarcoma is a disorder that is very difficult to treat. It has very poor prognosis. So here I use a combination of 2 drug regimen, right? And I have to choose 2 drugs from 4 drugs. One is high dose methotrexate, second is cisplatin, third is your doxorubicin, and fourth is ifosfamide. So out of these 4 drugs, I will choose 2 drugs, and out of those 2 drugs, I can use any one drug, right? Now, one thing you need to understand here, that I've already mentioned this, that whenever we use methotrexate, specifically at high doses, and that is what we do in osteosarcoma, then we need to use leucovorin, right, to prevent the toxicity of methotrexate on the bone marrow. Alright, moving on to the next disorder, guys, ovarian cancer. See, ovary cancer, we use a regimen that comprises of a platinum compound like cisplatin, and we combine cisplatin to a taxane like paclitaxel or docetaxel. So cisplatin plus a taxane is the treatment of choice for ovarian cancer. If they ask you single drug of choice, single best, so remember, in all kinds of urogenital cancer, be it uterine cancer, be it ovary cancer, be it testicular cancer, be it cervical cancer, single best drug of choice is always cisplatin, right? Now guys, moving to the next disorder for today, that is PDA or patent ductus arteriosus. See guys, PDA or patent ductus arteriosus, if I want to close, right, closure of PDA, the preferred drug in India nowadays is ibuprofen, right, more than indomethacin. Though international guidelines, they say they prefer more indomethacin, but I doubt they will give you both these drugs in the option. Now, in case it's a bad luck and they give both ibuprofen and indomethacin in an Indian PG exam, go for ibuprofen. But if you are going for USMLE, then go for indomethacin, right? And in case you want to maintain the patency of ductus arteriosus in case of any congenital heart disease, then I guess you know the answer, guys. Your answer is misoprostol. Prostaglandin E1 analog, misoprostol is the drug of choice. Though I can also use alprostadil. Alprostadil, it is also a prostaglandin E1 analog. Right, guys. So that's all in this section of drug of choice for today. Moving on to the second part where I discuss one monoclonal antibody nowadays. And today the antibody that I've chosen has never been asked, but I have a hunch that sooner or later this will be asked, because this is a monoclonal antibody that is used for prophylaxis of pseudomembranous enterocolitis, and you guys might have seen a lot of MCQs have been asked in pseudomembranous enterocolitis treatment in cause, but they have never asked about prophylaxis. So because there is a new drug which has been approved, and the drug is called as bezlotoxumab, BEZLOTOXUMAB. So TOX here stands for toxin, right? B for bezlotoxumab, tox for toxin, toxin for B, right? B starts with B. So it is anti-Clostridium difficile toxin B monoclonal antibody. So it is against toxin B that is produced by the Clostridium difficile, right? So that you can remember from bezlotoxumab. And it is used for prophylaxis of pseudomembranous enterocolitis in high-risk patients. And who are these high-risk patients? Mostly these are the patients in ICU. And to prevent infections in the ICU, we keep patients on antibiotics. So long-term antibiotic therapy, they are high risk of pseudomembranous enterocolitis. Now, one thing they ask is what is the most common cause? Now, remember the cause of pseudomembranous enterocolitis. The most common are the third generation cephalosporins like ceftriaxone, followed by aminopenicillins like amoxi or ampicillin, followed by fluoroquinolones, followed by clindamycin, right? So you have to remember this order of pseudomembranous enterocolitis. So bezlotoxumab is the monoclonal antibody for today, guys. Clostridium difficile B, right? It blocks that toxin. Alright, guys. So that's all in this section of drugs for today. And now let me have a look at the questions that you guys have asked in the doubt section, right? So let's have a look at the first doubt. Alright, so it has been asked by Dr. Kamal. So Kamal is asking, sir, how to concentrate in study and avoid using mobile. Someone else had also asked this, and I can see it's an endemic phenomenon, right? All of us, kids, young generation, middle-aged people, even elderly people. So when I go back to home, I can see my parents, they are also hooked to their mobile phones, smartphones. And if you would have asked me 5 years back, I would have never imagined that, right? Elderly people getting hooked to smartphones. So that's a part of our life, and that's okay. But the thing is that, Kamal, you need to understand, in your life, there will be situations where you need to change your priorities, right? And certainly, these last few months, you have to change your priority, your behavior a lot, because you know what is at stake, right? So let me remind you that if you want to go through this exam, right, and you want to get a seat, you have to go through this churn time and again. Are you getting my point? So I keep on reminding you guys this point. You should keep this in mind. Would you like to go through this torture of preparation, right, for another 1 year? Or would you like to change your priorities right now, right, and change those things which suck your productive time and focus more on your studies? So forget that there is something called as mobile. So Kamal, I would ask you to either switch off your mobile for some period of time and use it judiciously only during that time when you are relaxing, right? So suppose you're taking a half an hour break for tea, coffee, whatever it is. So use it only from break to break. And there is something you have to train yourself, train your brain, right? We humans, we can be trained for anything. Anything, I mean anything. All right. All right, guys, moving on to your next doubt that has been asked by Nishu Agrawal. So I'm done with 60% modules only, but I'll do for rest 40%. So Nishu is asking, what should I do for rest 40%? As modules are important. Nishu Agrawal, see, what you need to do is, as I've said, you need to practice MCQs daily, right? So going forward, so if you have not done those 40%, so what you can do is see the number of questions and divide the remaining modules into your daily routine, right? So let us say I want to practice 3 hours or 4 hours of questions. So I'll do those modules. Because remember, it's not only about studying notes. Notes are very important, but apart from them, solving daily questions is also a ritual that has to be done every day. So 40% is left, no big deal. So just divide those 40% adequately every day into 3 to 4 hours and keep solving those modules. So one, you will be having your MCQ practice, right? And plus keep revising your notes or whatever it is that you have accumulated throughout this time, right, Nishu? So don't worry, right? Now guys, moving on to the next doubt. It has been asked by Kiran Jairam. Sir, I am a final year part 2 student. I have 1 year to prepare for NEET PG. Please suggest me strategy, which subject should I give more importance and how to manage during internship. Kiran, usually what happens, if you'll see, is clinical subjects, we are, all of us, we are on the finer side in clinical subjects because we have recently studied in 3rd year, 4th year, right? Where we guys lack going to the NEET PG is usually the pre-para subjects, because we started it, in the 1st year, 2nd year, and more than 60-70% of the information, it has already been washed off our brain. Are you getting my point? So what you need to do is, see, whenever you start your internship, right, the pressure is too much to study fully, right? I mean, 24/7, you cannot study. So you'll be studying part-time. So I would ask you to keep the clinical subjects during the period of internship. So while you are going through your internship, right, while going through your medicine posting, so try to cover up medicine at that time during the medicine posting, so that you can have clinical correlation as well, right? You study things, you watch them, and this gives an impression, right? So suppose you'll study ECG, then you'll go to the emergency, try to look at those ECG cases, try to go through the X-rays, CT scans. So guys, remember, nowadays the exam pattern is such that your internship experience is also going to help you, because you'll be looking through a lot of X-rays, CT scans, ECGs, and if you'll actually devote your time, not just go to the internship just to get a signing certificate, no, right? If you're devoting your time and you are actively trying to learn something, and then only you'll be able to get a good rank, very good rank, right? So it's not just about going through the notes and videos, right? So we go through them, they're very important, but apart from that, you need to apply that knowledge somewhere. So when you're going to your internship, and if you can rhyme your medicine with the medicine posting, it would be very productive. Surgery with surgery posting, obs gynae with obs gynae posting. But before that, you can do that at ease and at your comfort when you are not bothered about your pre-para subjects, right? So before your internship starts, I would ask you to get a hang of your pre-para subjects, go through them, so that they do not become a burden for you during your internship. And during your internship, you can easily cruise through the clinical subjects, going through the videos, notes, and clinically correlating those stuffs while you are in your posting as well, right? So believe me guys, whatever they ask you, these images, CT scans, all of these things you see in the clinical postings. The only thing is how much you are interested in those and how much you retain those, right, while you're going through those things. All right, coming to the last doubt for today, it has been asked by Blossom Wings. Right, that's quite an interesting name, Blossom, that you have given yourself. And what is he or she, I don't know, is asking is, in the next pattern, if a final year student gets a seat, he cannot join residency for that year. Only when she does 1 year internship, then he or she joins, but that seat would be blocked for that year. So sir, will a clinical seat remain blocked for a year? Or is it because there is a shortage of doctors in government colleges, residents already are overburdened? So what can be done? See, Blossom, first of all, let me tell you something, that the next, it has not been finalized yet. Not been finalized, I mean, how is it gonna be conducted is not final. It is just a rough sketch that they have drawn, and they have thrown the ball into the court of the medical colleges and students, and they are seeing how we guys react to that, and based upon that they will make some changes. Now how, the only thing, if the point you are worried about, that is the only point that I was also worried about when I went through the document which was widely shared in the social media, that how this transition is going to happen, and even I could not figure out, right? So they might come up with something, and even I don't know, because this transition is the thing that is going to be difficult. But they will plan some way out of this, and certainly they are not going to waste a year. Don't worry about that. We cannot afford that. right? Because when you are running short of so many specialists, so that won't happen. But let me tell you something, there would be many changes with the next exam before it is implemented, because right, we live in democracy and nobody can just shove down anything through your throat, because whenever something is implemented, the pros and cons both are looked upon, and if the government does not agree to implement, then there are cases, there are counter cases, so these things will keep going on. But at the end of the day, the story is next will be implemented sooner or later. Now, how much time it will take, that's $1 million question that nobody knows, specifically when you are embroiled in this coronavirus pandemic. But the way things are going forward, right, the way INI CET has been conducted, the way radically the question pattern is changing, even for the last MCI screening exam, the pattern was changed. So I am kind of bullish that the next would be implemented at least by 2022. I think that. I mean, nobody can be sure, but that is what I think. And you never know, guys, with this government, they can implement it next year also. But I highly doubt that executing it at such a level would be difficult next year. So my bet would be on 2022. But how it will be conducted, how will be the change, right? That nobody knows now, because we don't have the final blueprint. It will come to us after some time. But what you need to do as a student, you need not worry, guys. You need not worry. If you're worried so much, then whatever subject you have studied, just go and try to attempt some USMLE questions. Would you be able to attempt or not? I think you'll be able to do more than 60-70% of questions, and they are far more easier as compared to our NEET PG questions. So are you getting my point? So the questions which will be asked would be more clinically oriented and concept based. It does not mean there would be no role of pre-para, because pre-para is something like foundation of a house, and you cannot build a house on air. Are you getting my point, what I'm trying to say? And why it is important is because, mind it, next is not only a screening exam. It is also an exam, and based upon the marks you're going to secure, you're also going to get a seat. So every mark counts. Now, you just want to get through the next exam and become a medical officer somewhere in the PSC and practice, then you might not pay so much attention to the pre-para subjects, because you might get through 50%. But securing 50%, qualifying the exam, I don't think it would be the aim of most of the students. Most of you would like to get a piece of that pie that is called as your PG seat, right? And for that, pre-para will always play an important role. And the best way to go forward is to kill the subject at the time when you are dealing with it. What I mean by this is try to cover up most parts of anatomy, try to solve the MCQs, questions of anatomy, try to make notes of anatomy, perfect notes of anatomy when you are in the first year. So try to conquer the subjects of first year when you are in first year, second year when you are in second year, so that your pre-para is done in first year and second year, and you would be relaxed during the third year and fourth year period, so that you can have an easy go with your clinical subjects, focusing more on the clinical learning side. Are you getting my point? And before the next exam, because you have studied so much in your first year and second year, you have your already prepared notes, you can just easily revise them. So now the focus would be to study segregatedly. Previously, what we used to do is we would study just to pass the first year, second year exam, third year, and after we pass the final year, we will leave everything and sit for 1 year and study for the AIPG or NEET PG, whatever you can call it. But now things going forward, if you want to extract more from yourself, you have to be a little bit different, and you have to spread your education throughout the 4 years evenly. And that is exactly what the government wants you to do, not to study bolus. Because see, you would understand that though we study bolus for 1 year, we get a rank, but that is not the right way to do. You would agree, but we humans are like that only, right? Even I am like that. But this will now tend to enforce some change in your education, and you will be bound to conquer a subject in the year itself, right? Going forward. So this is going to help you guys. So don't worry, guys. The battlefield, they might keep on changing, right? But the battle is same. It will be fought with the same weapons, with the same zeal. And the only thing which remains constant is courage. So you need the same courage which you need for NEET PG. You need the same courage for your next exam. And second thing is believe in yourself. Keep believing in yourself that yes, I can do this. And believe me, whatever be the exam, if your study is based upon concept and not just rote learning, then you can crack any exam in this world, USMLE, PLAB, NCLEX or NZREX or your NEET PG or INICET, does not matter. Alright guys, so that's all for today guys. If you have any such questions, you can always let me know in the comment box and I'll be more than happy to cover them in the next Pharmcast. So take care, bye bye. This is Dr. Ranjan with you.